So many times. I just especially why before the code, Rich, it's that let's expand that word, it's that kind of learn. Welcome, everybody. Welcome, everybody. I hope you are doing well. My name is Chioma Nnaji. I'm a senior program director at the Multicultural AIDS Coalition, which is located in Boston, Massachusetts. We have the honor of being the convening partner for United We Rise. Thanks for being patient with us, technical difficulties and all that stuff, but we are here and we are ready to engage in this very powerful conversation about political determinants of health and how they relate to HIV outcomes for Black folks. If you are new here, United We Rise convenes this, what we call couch conversation with every Black body. We've been doing it for the past several years. The whole point is to bring Black people together to have critical conversations around HIV and not just have conversations, but also produce collective action and strategies. United We Rise has been around for the past 4 years. We are a national collaborative of Black researchers, providers, advocates, Black people living with HIV, just Black folks who are committed and dedicated to addressing HIV, and not just addressing HIV, but also overall health outcomes and well-being and liberation for Black people here in the U.S. So I'm excited to start off our conversation by starting off with a grounding exercise. We always like to ground ourselves in the space. We all know that we're coming from doing work or doing home things or dealing with children, dealing with partners, all the things. And so we want to make sure that we come here and we are present in this space. So we are going to hear a little something. This is one of my favorite spoken word pieces. Some of y'all might know about it, but it's it's called You So Black. Max.
There's no audio. You got to come
Black
off
advancement, Black enhances, Black with chances, Black with privilege, Black with pride, on purpose, on the Black out, Black is not. It's not. Black when it's wrong and Black when it's right. Black is pyramids and mathematics. Black is melanized in magic. Black is televised and in need of drastic Black advancement. Black enhances, Black with chances, Black with privilege, Black with pride, Black on purpose, on the Black hand. Beautiful, Black and blessed and highly favored. Praise the Lord, Black and blessed. Black and so much more, Black and nothing less. Black and educated. Black is brilliance. Black is strong. Black is resilience. Black is song. Black is infinite, like hip hop or space. Black is grace. Black is love. Black makes babies. Black babies grow up. Black is tough. Black is hard to do. Black is me. Black is you. Black is not something we get to choose, but it is something we get to cherish. It's something we get to wear and we get to rock this with honor. I'm Black like my granddaddy and my great-great-great-great-grandma. Black is that lift every voice and sing. Black is that letting your freedom ring and resound. Black is adjective, adverb, color, and noun. You so Black. Oh, you so Black. When you smile, the stars come out. Baby, you so Black. When you're born, the God come out.
Yes, like I said, it's one of my favorite poems. How many of y'all can relate? It's a beautiful thing to be so Black, right? We are now an adjective and a what? Okay, a verb. So please enjoy that. I put the link in the chat, but it's very much connected to what we're going to be talking about today. What does it mean for us as Black folks to embrace all that we bring, all that who we are, and how do we turn that into action, and how do we address HIV through the understanding of political determinants of health? But one more thing before we get to that conversation, we are going to hear from John Mead, who's going to give us some policy and action updates so you all can be informed and engaged and ready to go when it's time to go. Hey, John.
Hi, good afternoon, everyone. So I have 5 minutes, so I'm going to talk a little fast. There's a lot going on. So we're in the thick of FY27, fiscal year 27 appropriations. Early June, we had the House Labor, Health and Human Services, Education and Related Agencies, or LHHS, subcommittee and the full appropriations committee meet to mark up the bill. Basically, they write the bill, and then they basically discuss, go back and forth from Republicans to Democrats, propose amendments, and all that kind of stuff. So that happens in early June. As with the last couple of years, the House has been proposing in their bill to significantly cut or zero out certain HIV programs, right? So I'll start with CDC. So CDC total for HIV related was in FY26, they were given $1.01 billion. In the president's budget, he proposed to cut it to $220 million. And the House sustained that for their bill, $220 million. So that's over $793.7 million just flew out the window. Right? HIV prevention in 2020, in FY26, $755 million was appropriated to CDC for HIV prevention. The president said $0. The House said $0. For viral hepatitis, STD, opioid, and TB elimination, in FY26, each of those funding lines got a certain amount of dollars. Like viral hepatitis got 46 million, STD got 164 million, opioid got 23 million, and TB got 137 million. The president proposed to put all four of those into a block grant of $300 million. And then the House for FY27 decided to cut that in half. So for viral hepatitis, STD, and opioid, put that at $209 million, and then leave TB at $137 million. So that's CDC. For HRSA, the Ryan White program, got $2.57 billion last fiscal year. And the president's budget brought it down $773 million to $2.497 billion, and then the House brought it down a little bit more for $2.346 billion. The ending the epidemic plan within HRSA zeroed out. It went from $165 million to $0. NIH got a bump up. The NIH in total, so research in general, got a bump up. And minority health, the Minority AIDS Initiative, which got 56 million in FY26, has been brought. The president said $0, but the House gave it 20 million, right? So that's kind of like what the bill looks like for the House side. As for the Senate version for FY27, because the House does theirs and then the Senate does theirs, the Senate discussion is at a standstill right now because they can't agree on what that ceiling number is, right? You need a ceiling, and then you could divvy it up in with defense and LHHS and all those other things. So they can't agree on the ceiling. Excuse me. But the Senate historically has been our saving grace. So the numbers that I just mentioned that was in FY26, the Senate fought for those numbers, right? It may have been a cut from what we used to see, but we would have had nothing if it wasn't for the Senate, right? So we need to make sure that the Senate does their job because they're going to need to save us from whatever the House is trying to do. essentially. So my message to you all is to reach out to your representative, House and Senate. To the House, basically detest what the LHHS committee put out. In the Senate, tell them to get their together so that they could come and save us, essentially. And one last thing I want to talk about, aside from appropriations, we need to discuss an administrative update that will affect federal grant making processes, right? We talked about appropriations, right? Once appropriations is done, these agencies that I just talked about grant that money out to health departments, to community-based organizations, through RFIs or RFAs and all these other mechanisms, right? But the White House's Office of Management and Budget has proposed new regulations that would significantly expand political interference in federal funding decisions across all government grants. This is not just health, this is everything. Everyone that gets a penny from the United States government is under this rule. So essentially, this administration is increasing the use of budgetary and regulatory tools to bypass longstanding scientific peer review and congressional processes, including they could withhold funds if they want to. They could cancel grants whenever they want to. They can do literally whatever they want to. And thank you, Max, for putting an action alert into the chat. This moves OMB from mainly giving guidance, and then the agencies kind of take that guidance and apply it to their grants, to being, this is a mandate. This is how you're supposed to do this, right? So we are urging everyone, every organization, individuals to comment on this rule. The comment period ends July 13th. We need everyone to do this. Currently, there's over 30,000 comments, right? And we still have about 2-3 weeks to go. So please, 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 if you want more information on how to comment, I could email Chioma and then we can email it out to the group. But we need everyone to comment on this because they can't ignore comments. That's the point. By law, they cannot ignore comments and they have to address a lot of these comments. So that's what's happening in policy. I'm sure that there's a lot more, but I'll keep it at that since I only got 5 minutes.
Thank you very, very much, John.
Thank you.
Like he said, we have to put action to what we need and what our communities need. If we're not doing it, ain't nobody else gonna do it.
Exactly.
So please make sure you're clicking on the stuff in the chat and make your voice known so that we can move against what is happening at the federal level and even within your own state. Thank you, John. Thank you very much.
You're welcome.
So that was a great intro. That was a great sort of example of what we're going to be talking about today. And so I am going to introduce our 3 discussants, the 3 folks who are going to hold space for us today. And we're going to do a format that's a little bit different. If you've been to our couch conversations, you know that we usually engage in some conversation with discussants, and then we get into some Q&A with you all. We're going to do something a little bit different because we really want you all to get and understand this framework called Political Determinants of Health. So we're going to do, like a PowerPoint explanation intro, and then we'll be able to get into some more discussion, and you'll hear some examples of ways in which this framework is being used to build power within Black communities and to do collective action around HIV. So I am going to introduce our facilitators, Ms. Vanita Ray, Max Boykin, and Kamara Lafrey. Welcome, y'all. And again, we're talking about Political Determinants of Health, a framework for building Black political power to improve HIV outcomes. And Ms. Vanita, I think we're going to hand it over to you first.
Hey, folks. Thank you all for being here today. Let me, as Max is pulling up the PowerPoint, let me just say, because I see some of you PhDs and doctors on here, I'm not trying to teach you about political determinants of health. I am going to be talking about tonight using political determinants of health as a power building framework. If you know me or know of the work I do, I'm trying to build power through building leadership and things like that. And especially since being diagnosed. And when Daniel Dawes' book that came out in 2020 about the political determinants of health really just sparked something in me that said this is a power building framework we can use. So that's the context for which I'll be sharing today. I think John Meade was perfect because he was talking about the budget, and the budget is a policy document. It is political. It tells us what this government thinks is important. And so they just told us that they don't think HIV is that important. So we can argue at the level of our friends, or we can argue upstream and begin to build power there so we can influence these outcomes in other ways besides some of the ways we were just talking about. So keep going, and just that's the perspective I bring to this. And I don't know if all of you know, and most of you probably do, who Black South Rising is. I'm not going to spend a lot of time. Max, give me a 15-minute time keeper, Max, so that I can stop. I want to hear people. If you know me, I get a little carried away. So that building political power is the mission of Black South Rising. And next slide. I'm not going to talk that much about it. Hopefully we can today to talk about how power and policy shape health inequities, which HIV is one, differentiate between social and political determinants of health, and then apply that political determinant health framework to build power. And we can identify some of those actions that will help get us equity around HIV and all kind of healthcare. I will be talking about HIV because, of course, this is the framework from which I approach this, but I'm also talking about broader policy that influences HIV outcomes. Because remember, sex is only a transmission route, right? So just remember, this is a disease of inequities. It's really not about behavior, it's about systems, but even though we focus. So next slide. Just wanted to set a little context that the fight for health equity isn't new, y'all. And I want us to think of it in that context, other than just thinking of this moment here now. And what some of y'all, I know, I see Marsha Martin there, been doing this 30 and 40 years at the international, local level and everything. But the fight for health equity preceded us, y'all. And Daniel Dawes talks about this and some others, that, ever since the ending of slavery, this country has struggled with who's going to provide health care and educate those free people, and so that fight has been going. The Freedmen's Bureau lasted a few years and we were able to get services, but ever since that's been dismantled, the fight for health equity has continued on. And that resistance to health equity and the conditions to which Blacks found themselves trying to navigate after the 13th Amendment and through the 14th and 15th is, those conditions, creating laws like vagrancy laws and all that shit that end up putting us right back in a system, because the 13th Amendment said there's an exemption to working without pay, and that's if you're in the criminal justice system. So the resistance created those structural conditions and those vulnerabilities to which we are still dealing with today, y'all. And so it didn't, HIV isn't because Black folks had sex. It's because the whole world has sex. And we have some of those inequities that create the vulnerabilities more in our community. But the first real time, other than issues of Medicaid or Medi-Cal raised in California, the first real attempt or passage of health equity was through the Affordable Care Act. And that was, even though it happened under Obama, there had been health equity folks fighting for years around health equity who had created some of this framework, and to which was, and if you notice, it was passed in 2010, but it's damn near dismantled, and there's been a concerted effort to dismantle it. So in addition to fighting for health outcomes for HIV and stuff, we're fighting a bigger fight too, even though we tend to focus in one area. Next slide. And I'm not going to talk more about this because I have limited time, but y'all know Project 2025, which is what, 70%, 75% implemented, is a political document. While, in the HIV arena, we always talk about social determinants of health, which is the effect of the lack of political power, what we get. And this document has got them playing politics in an area that we are not always playing in. And so to me, in response to this, it's not new, but in response to this idea of building political power, when we see now our legislators, we're losing our voting districts and everything, and that is a dilution of Black political power. And so we've got to use some of those same mechanisms to build the power we need, to have the communities we need, and to get the services and support and the things we need. So political determinants, and you all check Daniel Dawes' book, it's great, but political determinants are those policies, governance, and structures that create the conditions that result in those social determinants. So it's those policies, it's voting, it's a responsive government, it's all those structures that are created a lot of times above our head. John Meade was just talking about some, a budget is a policy document. It tells us what's important. But all of those policies and power structures are what in effect influences our social determinants of health, which are the actual lived conditions, experiences we experience in our communities. So what I'm saying, we can't always just fight that at the point of the problem. We must go upstream. So it's voter suppression. Y'all saw what happened after 2020. And it's continuing on. Yesterday, I saw a thing where in Texas, the governor just made the Secretary of State resign. And he did it at this time because he doesn't have to now go through the regular process. He can appoint someone and they can be acting while we go through the midterms. That isn't an accident. Next slide. And so I want folks to think about social determinants of health being those things that happen downstream. They are the effect of what happens in DC or in your capital or in your city council. They are the things that happen downstream. So the political determinant, those are the policy choices, the power dynamics, the governance systems that influence and create those social determinants. Who gets what, when, how, and from whoever. The voting laws, you see what the Supreme Court just did. That was operating in the political determinants of health reference, and the social determinants of what we're left with unless we get up and fight upstream, which means voting, which means pushing back, which means organizing, versus the social determinants are those conditions in which we live and are born and survive every day. Y'all have heard of the broken window syndrome. We know that when neighborhoods don't have what they need, they produce what we've seen and what some of us have lived in. So income, education, access, food deserts, all of those things happen at the social determinants of health level. And I'm saying to change that, we've got to fight the upstream fight of political power. Next slide. And because I'm trying to stay on time, y'all. And this, y'all, I'm not a graphic, but I wanted to show this for someone else, this upstream stuff, political determinants of just like a stream, what you put in the water upstream flows downstream. When we put shit in the water downstream, it don't go back upstream. We don't build power at the point of the problem unless we're using that power to go then fight upstream. So it is, we can still deal with the effect, or figure out how and what we might be doing now is already building that political power. But I just never thought of it as a total power building framework, that everything we do can be put in this arena. And if it's not, how do we connect it to this arena, to this framework? Next slide. So should I let you talk? Because HIV racial justice. Go ahead, Max.
Yeah, I added a couple slides in, particularly because we're talking a lot about political determinants of health, how in which we're doing this. And we talk a lot about power, especially when you're talking about health equity. You're talking about also in the combination of power. So one thing, because next slide I'm going to talk a little bit more about also what we mean about political power. But power is just the ability to make circumstances happen. This particular definition of power comes from HIV Racial Justice Now, which both predates Black South Rising and United We Rise, as a culmination of different folks working in HIV work who were thinking about how in which we also truly build power in this time. And it was a clear piece that we also made, is like power is when we collectively come together. Power can also be when collectively the forces against us come together, and they will do that many times as well. And we're seeing how their power also aligns and stacks up against us. But when we are building together, when we are actually making and using those controlling our different circumstances, and taking control of that, that is when we'll be able to build power the strongest. And we talk about building political power, and we did a retreat last year with Black South Rising, and we talked about our different value statements that are also put up here. But more importantly, we had to talk about, I was like, what is political power, especially in the South, where they're constantly taking the Voting Rights Act, they're taking away both our health care access, while also increasing the criminalization of us, increasingly putting us back into cages. So when we think about that, is we do this through education, organizing, leadership development, and to understand the political determinants of health and act through the different ways in which we can do this, voting just being one of them. But we also understand the continued advocacy that many of us are doing, the different resource sharing, mutual aid, but also one of the things we keep talking about is like having the meeting before the meeting and the meeting after the meeting. So we are making sure that our communities are clear about how in which we are building power in spaces that are not always and many times not built for us. As I know some people have talked about the PACHA meetings that are coming up, of some of the different city council meetings that are coming around, as they are continuously attacking, and we'll talk more about this in the later discussion around ADAP and its attack on the different states that many of us are in. We want to think about how we're building that political power, because we're understanding that they are making these decisions, as Benita just talked about, through political decisions that impact our economy, impact our healthcare access, and impact the other ways in which we are able to live. And with that, I'm gonna pass it back over to Benita to talk a little bit about this power and some examples of power building.
And let me say this, I think of power with the little p and power with the big P. We're talking about the big P power here, that have the ability to decide whether I get to eat or not, the big P power. So, and if some of you might have heard a couple months about what the historically Black college in South Carolina, and those kids did not want the speaker that they found out they were going to get. Those kids organized, did a petition, march, and everything. And they end up, sounds like a small power building activity, but those people will understand they came together and they created change, and they end up getting the speaker they wanted to have, or they didn't get the one they didn't want to have. So as a power building framework, and nobody needs to go around saying political determinant, all I'm talking about is power building and upstream and the way we can connect our work. Here are some examples that we've come up with, just at an individual, organizational, and a systemic level of work. Engaging in advocacy, building your skills like you are all on here now. And I guarantee you, some of you have even more. You just may not have thought of it this way. Or even if you're giving out food, you can give out a voter registration card. You can show them to connect their ability to give food is connected to something else. No activity, every activity, in my opinion, can have a power building component to it. But so individually building your skills, contributing to political education like we're doing here today, seeking public office, or just getting a job in public office. Some of us who know when we work at the legislature, we deal with those staff more. And to be honest, the staff is a really good resource to have. From an organizational level, how do you sustain Black-led organizations? You know, we need, whether it's sustaining those leadership by giving them pure spaces to talk and feel supported, because it doesn't happen. But how do we work on sustaining that infrastructure that we need? So, you know, to talk about whether maybe all organizations won't make it. Maybe three of us need to get together and say, how can we sustain the three of us, whether we collapse two or something, but how do we sustain them? Centering CBO-led strategies that are founded by folks of lived experience or people living there. But how do we get organizations that are working in our communities to become spaces for us? Possible meeting spaces. I worked at a FQHC and they never had an idea of how many meetings and how much shit got done in those conference rooms at night. If you offering that free space to people makes a difference. Voter registration, information, delivering training, supporting nonpartisan activities, organizations, 501c3s can do that. Systemic level, building and sustaining coalitions. You know, the power dynamics in coalitions when it's individuals and organizations is totally off. So how do we sustain those? Sharing resources. If you have an accounting service that works for you and I can't afford it, can we share that so we both can survive? But sharing data, sharing information, creating information hubs. If you've got the communications resource of the data, why aren't we saying you do that, we'll do this, and we can share? Pooling staff and funding. Can we go after money together? grassroots strategy. I have a friend that's getting ready to be a polling precinct judge, just to be in the space. So there's way more than this, and I'll stop. But what we are talking about here today is using this framework as a power building framework because of the need to build power upstream as well, to become those decision makers, to influence those decision makers, bird dogging, all of those things. And this is busy, so I'm not going to go over this. But on the left, if you get Daniel's book or just Google this, you'll just see this kind of framework for political determinants. And you'll see up to the right there at the top, equity versus inequity, and policy, government, voting. You see advocacy down there, but they all flow up. So your advocacy ideas, leadership development, capacity building, versus social determinants of health are reporting on the effect. Now, the effect don't have to be negative. It just is. And I would proffer, which some of you I'm sure would too, that the lack of influence in decisions upstream, or the lack of power upstream, results in some of the social determinants that we experience that we don't have to. So, which I'd like to see change. I don't want somebody in the HIV room, well, why is it like this? And everybody goes social determinants of health. That's crap. It's not why, it's the because, it's the effect. And when we say social determinants of health, it gives everybody a way to put it in a neat bow. You ain't got to unpack it and say racism, poverty, gender inequities, and I would say to y'all, let's start unpacking it and talk about where do we build the power to overcome some of those systems. And next slide. I'm going to stop. I think should be this. I want to just show, because United We Rise is about an intersectional approach, and I'm proffering, we thinking about root cause analysis, that HIV is purely the leaf on the tree, y'all. The systems that created the vulnerability and the disparities are all of those other things, the root causes of homophobia, of inequities, of racism, of power, of social construct, of race, of so much. And so I just want you all to remember, when we're arguing over behavior can change on the outside, but it doesn't change the systems that were created that create the vulnerability anyway. So just to think of why the intersectional approach is necessary, and to even to improve HIV health outcomes. So if we're in a time where we got a government, an administration that for the last 2 years has zeroed out HIV services when they transmit their budget to Congress, that tells you something right there. Whether we get Congress to put it back, what about if we don't elect the Congress that we need to put it back? What do we do then? So I will stop now, but we're just all about building political power to improve health and HIV outcomes. So thank you all. And Max, I don't know if I'm over, but I'm happy to stop. And thank you.
One, I just want to say thank you, Benita. I've had an opportunity and chance to do this presentation, talk about the political determinants of health throughout the South, and get feedback from folks on how we continue to not just make the presentation better, but also continue to engage around and talk about being a part of the political process instead of talking around it, which is one of the struggles and issues that I've had at times, even within our overall community. As we understand that politics is always engaging our access to care, but we struggle with actually talking about the politics and the little elephant in the room that is engaging us. So I want to encourage all of us to be able to have a verbose discussion around what not just the political determinants of health is, but also how in which we use this as a power building tool, as Benita has talked about. And I'm gonna pass it back over to Chioma. I just want to give a big shout out to Benita for doing so, and pass it back over to Chioma as we talk more about how we've been able to use it as a power building tool.
Thank you. All right, everybody just take a breath. I know it was a lot, and I know we're all trying to dissect it all, but the great thing about our couch conversations is that we create time for us to have discussion and ask questions so that we can all learn, and then when we leave this space, share. So I am going to bring our discussants up to the front. And while I am doing that, please, folks can feel free to put questions in the chat. We will get to your questions. I just want us to spend some time putting what all has been shared by Ms. Vernita and Max in perspective and really talking about it from a real life challenge that has been happening in the South, like Max mentioned. So let me just start with our first question, and then we'll just see where it goes, where it flows. So I'm going to hand this question over to Kamaria. Please first introduce yourself in any and all the ways you want to. I'll just say you're fabulous and amazing. And I appreciate bringing your presence every time. So my question to you is looking at Florida, because you are in Florida and you've been involved in a lot of the grassroots organizing and advocacy work happening there around ADAP. What political decisions or systems made the proposed cuts possible in the first place? And this will allow us, again, to think about the political determinants of health as it relates to HIV medication in Florida.
Thank you, Chioma. Hi, everyone. Kamaria Laffrey, she, her pronouns, based in Florida. I am the co-executive director at Sarah Project. I'm also a coordinator of the Florida HIV Justice Coalition and a member of the U.S. People Live with HIV Caucus and PWN. So all the hats, all the ways I've been informed into this advocacy. And I come into this space as a woman living with HIV, as a Black woman in the South, as a mama, as somebody who's taking care of her mama. And so I'm naming all those things because those are things that I, as an individual, am holding. And so when we talk about building power, like how do we help people navigate their personal lives to be able to respond to the larger issues? And so specifically in Florida, one thing I've noticed, and I jokingly say this, but like, we're a hurricane state. So we're always preparing for hurricanes, whether they come or not. But yet we can't seem to prepare for our healthcare and saving people's lives and providing them resources and spaces to ask questions and be in community with one another. So one thing that I did see was, while it felt like the ADAP crisis crept up on us overnight, the response on the ground from folks in my community, I'm not knocking anybody else who was doing work on a legislative level, but the folks I saw that were pulling on community were former workers of the health department. I'm blanking on her name right now. Her first name is Tammy, but I forgot her last name. Tammy Kyler. And Mama Alicia came all the way back from Georgia, back to Florida with Black public health folks, and did listening sessions. Black South Rising came and did a sort of listening session focus group of folks. And I'm naming those things because that felt like the healthier response than sitting around waiting for responses from emails and waiting for meetings to get rescheduled. I remember sitting at my Ryan White Care Council meeting when we were first told about this in January. And then it seemed like no other plan was going to happen until someone sent an email. And there were folks beyond that were saying, we can't wait for an email. People's lives are being impacted right now. So what I'm saying all that is, in the systems that are built that are impacting our lives are not built to save us. And we can't wait for them to be in the response to the crisis that we're facing. And we should be in a more preventative approach of looking at how do we make sure the people who are impacted the most are responsive. And that's what I was seeing from the entities that I named, that were making sure people, and positively you with Janet Kitchen, making sure folks are still getting their insurance premiums addressed, and are still doing that now while we wait for a signature from the governor, hopefully Thursday or Friday. It just went to his desk, so we're hoping that he'll sign. But that still will not be the solution. That will not be the green check that saves everybody. There are still going to be folks that fall in between the cracks that didn't even qualify for the AIDS drug assistance program as it stands. And so that's another system that we still have to not solely rely on. We fight for it to keep it, but we can't solely rely on it to save us. And we have to mobilize and support one another through the connections and community on the ground that we have. I don't know if that really answered the question, but that's just what I was trying to summarize everything all together from the past 6 months.
Yeah, thank you. I think that actually gives a good sort of overview of what was happening, and how even the reaction that had to be taken was an urgent and immediate reaction. And how sometimes we get in spaces where we want to think and process, and how that thinking and process is causing people's lives, right? It's causing lives. So I know
But
you
can
being
I say
in the
something?
middle, in the yeah. Mm-hmm.
I wanted to say, but what they did, they found out the problem and they started mobilizing on the ground. There was folks who were mobilizing on the courts. There was folks, there was all
Everywhere.
level of action to understanding the assignment of influencing the certain decision makers. And so I give them more props. They could write a little book, just like we saw in Minnesota and other places, how folks organized to fight and push back. I'm done.
Yeah, you're actually going into the next question, right? Like, what are some of the specific ways? Because we use the word organizing, and I think sometimes it becomes so general for people, and people don't know, like, what is the practicality of it? Like, what does it look like in action? So Kamaria or Max and Ms. Finita, you could step into what were some of the specific ways that people were organizing? And that's organizing. I'll use the term with the big O and the little O, right? Organizing in our houses with 2 or 3 folks, and then organizing in the sort of the big sort of in the streets, like Ms. Vanita just said, in the courthouse.
Yeah, I appreciate this question because I think a lot of folks outside of Florida and in Florida, they saw the big activations that happened with legislatures. So there were demonstrations, there were buses sent up to Tallahassee, there were hundreds of people that came out. I don't like saying protests, but they did demonstrations. They had press conferences. They had the signs. They had the shirts. That played a significant role because inside the building, people are having conversations and meetings. So that is a form of organizing as well. And I've said from day one, like everybody has a role to play, no matter how big or how small you think it is. The other piece that I was able to participate in that I saw felt more meaningful to me because I feel like I'm always in a policy legislature posture and I wanted to do something else. Like, what else can I do to bridge the folks at the church that aren't going to go to the Capitol and the folks in the hair salon that are not going to go call their Congress folks? How can I help those individuals understand? So one thing that I wanted to do to channel my feelings, I'm a Cancer, so I have a lot of feelings all the time, was I wrote a pre-obituary. Didn't think anything of it, didn't know anything was going to happen with it, but it helped bring media attention to that. So I think media helped play a significant role in bringing more attention for other states to have their eyes open to what was happening. And all this is happening simultaneously. And then additionally, what I really appreciate was Leisha McKinley Beach, Tammy, and Sean Tinsley, all organized to have intentional meetings in cities that normally do not get visited to have these conversations. And so they did this tour, and I really appreciate like the question, the prompt in those rooms was not for your traditional, we weren't preaching to the choir. So when they came to Little Old Winter Haven, where I live, they were having conversations about, if you only have 45 minutes to solve this problem, who needs to be in the room to help address it? And that's what helped inform who was in the room, and that's who helped inform how the solution was going to be resourced in that area. And I know that they're continuing to work on building reports out. I don't want to put more labor on Ms. Leisha. I saw she joined, but I know that there's more to come from that space. And I know it was also helpful in individual conversations I've been having when people see the media attention and they approach me. So the organizing gets amplified through storytelling as well. And I'll end with that. I think storytelling is a significant part of it. We just got to be really, really careful about asking people to do emotional labor and trauma through storytelling without compensation and without care, without making sure folks are taken care of after that media attention. There was another advocate, Tori Samuel, who put her entire family and her entire story in the Washington Post, and has had to deal with like individual situations that have stemmed from that. So we have to make sure we're taking care of people to tell their stories as well. So I'll stop there.
And I wanted to make sure you all saw that strategic storytelling was on the power building activities. The more we uplift our stories, and that is a power building activity. Remember, the personal is the political. The things you are going through in your personal life are the stuff policies are made from. There was an issue, so we advocated and a policy got made. So never underestimate the value and the power of your story and owning it, and not going to somebody else always to give your story away. Really, it is a power building tool that you have. Go ahead, Max.
Yeah, one, the power of storytelling is ultra important. I want to super uplift what Kamari did with the pre-obituary piece, and having more and more folks to be able to do that across the country. But it also does take then being able to talk to people about how they do that. It's having weekly calls also with folks to be able to talk about what that means, and also the follow-up around it, and also making sure that we do also do the follow-up work of taking care of our folks, and also thinking about with any follow-up of organizing and thinking about is also thinking of next steps. What is the follow-up to continue to do it? Sometimes we always don't know the next steps when we start off because we don't know. And the other thing, well, two things I want to do before we jump off the Florida piece of like the important steps of organizing that was done there. One, because I know she's on this call and I was a part of what she was able to do in Georgia, and then also take it, change it, mold it to what they also needed to do in Florida. And also she's an important part of starting Black South Rising. Shout out to Alicia McKinley Beach. Learned a lot from you from all of our tours of the South. But really taking that time to actually do that engagement and further engagement and bring in some of the voices that are not always uplifted. And the second part that I wanted to bring up was I got to see both on the large national level of medical providers and large ASOs organizing themselves, but in many times leaving our folks out. And not actually making sure that the people that were most impacted, not making sure the Tammys and others are actually in the rooms and talking through it. And making sure when our folks are in different power positions, we do bring those folks in the room. We do make sure that they're able to continue to move forward. And when we see large scale organizations uplifting only one type of advocacy that does not actually include some of the people most impacted, and particularly the Black women who were holding up so much of that work in Florida, I want to make sure that we are able to make sure that, oh yes, and there was some great, amazing, powerful work going on in Tallahassee, but we also knew that folks were doing work across in the small towns, like they said in Winter Haven, but also doing it in Fort Lauderdale and Miami down there, to make sure that it is a fully connected work of statewide work. Because for most of us that ain't in a great state of Georgia, our state capital is not in the same place as where our work is, where most of our community is. So we also have to think about how we're also doing the organizing and making sure that the policy decisions made in our capital are also making sure that to the deepest, darkest parts of the state also know what's going on, and then they can bring that back to the folks that are making those decisions at our capitals.
Thank you. So you all mentioned a couple of organizations and individuals. I do want to focus on the role of Black-led organizations. And I want to say this in a way, well, whatever. I'm just going to say it. So, one of the ways that, United We Rise talks about Black leadership, and I always give a shout out to Aquarius for framing this for us, and making sure that United We Rise is very intentional, that not all Black leaders are for Black people. Am I lying? Okay, all right. I just want to make sure I'm in the right room. All right. So when we talk about Black leadership, even as we talk about individuals and we talk about organizations, what does it really mean what is the role for our Black leaders and our Black organizations? And so these are individuals that, yes, they're Black, and they are about Black liberation, not only about speaking about it in what they call the backstage, but also speaking about it in the front stage, right? Like being very public and very clear about their values and their principles around ensuring that Black people are leading efforts and that we are moving towards liberation and not just thinking about sort of the now, but also thinking about our overall well-being. So what would you say is the role of Black leaders and Black-led, Black principled organizations in doing this work? Yes, HIV specific, but also all the ways in which we talk about HIV adjacent issues.
I don't know who wanted to kick this off, but I'm gonna start this one off a little. But one, I think it's always the role of institutions and Black leaders to continue to pour into a future generation of folks to continue to do this work. and to continue to mold and allow space for liberatory principles to continuously be engaged within Black spaces. And when I say that, I'm also saying it's like, oh, how are we talking about self-determination? How are we engaging around what does it mean for our communities to be able to take care of themselves? Also, what does it mean when we have new type of policies being able to gauge? I think it's important for us to be able to have important conversations in rooms and be able to stop and say, hey, this is not normal. How do we actually engage and strategize for this? They also need to be the important container for strategy to be able to be taken. For me, when I think about a lot of, when I would just take action because that's because of the rage that may be in. Folks need a conduit to be able to put that rage into actual action to be taken, and to continue to be like the strategic spaces that folks can be able to do so. I also think what our Black leaders and entities should not be is gatekeepers, should not be the ones that are making it harder for folks to be able to engage, and they should not be making it harder for our communities to be able to get access to resources. And they also should not be caping for white organizations to be able to continue to keep their resources and to make sure that those folks are being taken care of. It has to be actually done in a way where it's like, actually, you have to come in and make sure that the folks in the community that is most impacted are actually being uplifted. That is the goal. That is the importance of Black institution and also Black leaders in this time. And BSR has talked about it. I know HIV Racial Justice now, some of the other entities that are represented in this space. So I just wanted to shout us all out for calling that out. But we also got to continue to hold our different institutions feet to the fire as they are moving in these spaces and at times not moving for our community that's most impacted, and for getting certain folks, specifically our Black trans community, particularly forgetting about the Black incarcerated and formerly incarcerated communities. We have to make sure that we're bringing those in, but also people who use drugs, people who are dealing with domestic violence issues, folks that are also dealing with this hardened, horrible economy that we're going to be in, and we cannot leave just certain folks around to hold a couple of our folks together.
Yes, and period. What else y'all got to say about it?
I'm reflecting on this comment in the chat, and I was reflecting on how I was me specifically brought into this, and like how we talk about bringing in new leaders. And I'm reflecting on like who I had to identify as mentors, people I thought were going to be mentors, just threw me in the water and told me to swim. You're a trusted Black woman. Everybody will listen to you. High five. You're doing a great job. And so when we talk about Black leadership, making sure that we're building those containers of support and mentorship that are consistent and that feel safe. And so that folks don't feel tokenized or exploited when they're brought into those leadership roles, so they then feel equipped to bring in more people. I know for me, I'm a mama bear. I'm not going to bring in somebody into a space if I don't even feel safe in that space. So those are more of my reasons. And I think maybe one of my commitments is like focusing on how can I do better about that, and who can I be working with where it looks safe, where I can bring in more people. And I feel like I've identified spaces like this through United We Rise, bringing more people into that space, and Black South Rising. So that's just something I'm reflecting on. And I'm sorry I didn't refer to the chat, the comment that I saw in the chat, but it was just someone was stating that we need new faces and leaders to work with our existing leaders to inject newer ideas and strategies into the mix where things haven't been as effective as we want and need. And that's what got me to thinking about that, of how do we support the leaders that are, for whatever reason, put into a role to make sure that they're mentored, supported, and resourced so they can sustain that generational power building that Max is talking about.
Ms. Vanita, you have thoughts around Black leadership and the role of Black-led organizations?
Yeah, I guess I like what Kamaria, I'm having a space cadet day, and Max said, but what I guess I want to reflect on, there are organizations where the leadership happens to be Black, and then there are organizations where Black leadership is intentional.
Yeah.
I remember giving a presentation in New Orleans about how to bring racial justice into an organization, and folks who are Black, just having to be Black leading the organization, challenged me for hours. I ended up having to go to lunch with them. And what I finally got them to see, that other than them being Black, there was nothing else Blackness about the organization. There was nothing in the mission, the vision. They were using the same language of their white peers. They were using the same, tokenism code, because they were trying to keep their doors open and get money and compete with their peers. That type of, so I'm happy to see Blacks leading an organization and just going there, but I'm particularly interested in the ones that are intentionally Black led and wanting to be Black serving. And so make sure you understand which ones you're dealing with, because what Max was talking about doesn't sound like the former. And I don't even want to throw them under the bus. I'm more interested in just going around and dealing with the ones who want to be about this. They are Black led, intentional. It's in their mission. It's somewhere in their statement. It's not, you don't have to guess what it is, because they put it in writing and want to be held accountable. That's very important, because those are the folks who are going to act differently. They're going to operate differently. They're going to try to maybe decolonize, some of their actions, or acknowledge that they're there. They may be talking about abolition. So be really aware. We've got an organization that had race in it, and they said we're about race, but they changed their name and they're not really about race. They don't do any Black centered discussion or any type of, so just know which one that is. And I think that latter is really important, because those in 2016 in the movement, up until then, we hadn't really been talking about Black or versus white in this movement. In 2016, HINAC in Alabama changed the game, at least in my experience, when white folks realized that Black people's experience in the HIV movement was different than theirs, how we experienced criminalization, and that we were not all equal, even in this movement, and most of these folks were LGBTQ, and realized that they hadn't been advocating for racial justice. We were all advocating for LGBTQ justice, but not racial justice or HIV justice. So I just think bringing it, and if you're finding those values that you align with and bringing it there, and they're very important, because we need them. They're the only ones who are operating from a position of our lived experience, understanding what we need. So those are the organizations we want to sustain and keep going, support their leadership, because they are part of community. So I think they, not to want to put all of the responsibility on them. I think we need to be coming to them to help, to support. Kamaria is a co-ED of her organization. We should be saying, what can we do to support you, Kamaria? Because she is a Black woman out there living with HIV, leading an organization. So I think it goes two ways, and just be clear which organization we're dealing with. I would say that, because some organizations would just happen to have a Black person at the top, not that the organization is itself Black identified. I'm done.
Max, did you want to add something to that?
I wanted also it's important for us to look at any organization and also the role of the board. The role of the board and how in which they also are used. I said this last year, Shad for SAC, and I'll continue to, I've seen just multiple times where boards that, when an organization is moving in a way that is more liberatory, more pro-Black, where they have been reined in, watered down, made something that is no longer what our folks need. And then we become back into a cycle of like folks being like, oh, we need more, we need to do this. And we actually have done the transformation or tried to transform some of these entities that have done so, or created entities as folks have done. I want to shout out Thrive SS that have done so, but also seen it where they was taken away from folks. Thrive SS.
Do they still exist? I'm sorry. I'm gone.
Thank you.
And I want you all to remember, you all may not know this, but Black South Rising started because of issues around Black leadership, seeing so many organizations in the South that were operating plantation-like, where there was white leadership at the top, and the field folks were particularly Black, prevention field folks, case managers, and all operated by Black folks, but all of the decision making was at the top with white folks. And it was one of the genesis or one of the reasons BSR started. If you go back and look at some of our original statements on blacksouthrising.com, we talk about making decisions for us and by us, being accountable to the people we serve and things like that. When you don't have that, there's no accountability. And because of some of PWN's work, I'm gonna be honest with you, some of them same organizations now have Black leadership. I'll say Southern AIDS Coalition, the second Black woman leader. Never mind, we've got Center for HIV Law and we're the Cyril Project. Look at PWN. We're extremely proud to see that. And if we don't push back in places, we might not have seen that. This didn't happen accidentally that we've got this Black leadership. It happened because folks pushed back and advocated at different levels to get Black leadership in these organizations. And some of us were sacrificial lambs for this. But I just wanted to give some historical context. Now we can point to quite a few in the South that didn't exist before.
Yeah, and I mean, there's a lot that came up for that in question. I think one is sort of what is our role in supporting Black leaders who are intentionally doing the work around Black leadership? What is our role in supporting organizations that are Black-led and Black principled? And Max, you brought up sort of the issues within organizations between maybe the board and executive director, or maybe the board and seeing the bigger vision. And so there's a lot of questions there, but I wanted to give time for if folks have questions for you all. Participants who are here in this couch conversation with us have questions for you all. I do have another question, so I'm going to offer that question while people are putting questions in the chat, okay? And so I would like for you all to speak a little bit about, we know what's happening in Florida. We know that is extending past Florida, because once it works in Florida, they're going to start putting it everywhere else. And so what do you think are the lessons learned for Florida, and what do you think that other states, Black folks in other states, need to get ready and prepared for? And I want to say this within the context. I think sometimes we're like, it ain't happening in our state, and we're looking over at Florida saying, damn, like that's messed up, right? And it's like, what can we do? It's all the way in Florida, right? But I want us to think about this from a lens of solidarity, Black solidarity. And so what can we learn from Florida, and what do we need to prepare for those of us who are in other states, including those of us who are in northern states that are not seeing the same impact as the southern states are?
I'll add this just because it's something I don't lose sleep about a lot of things, but this has been a rough year. And one of the things I've been noticing, and that I think is a lesson learned, is this sense of complacency that we've had of like the systems that we have fought for and built, as far as like preparing people to go to care council meetings and making sure they're part of work groups and things of that nature. I've felt and witnessed kind of a tapering or a falling off of that because everything's on fire. So people are trying to figure out where to put their attention.
Mm-hmm.
But the problem that happens is that, like what I was saying at the top of the call, is we have these processes or policies built within our work groups of bylaws or whatever the guiding principles are for that group. And then we rely on those things that we created, that we act like we can't change them. We act like we can't pivot and be more responsive when a crisis comes up. And I think the lesson for Florida, and I remember being on a call where someone said this, is that we got too comfortable in the past 15, 20 years with how things are structured with one particular advocacy group in Florida. And they are revamping their entire way of how they even do membership recruitment and engagement. And so taking a look at what exists right now that hasn't been working, like, because we've been saying this for years, that particular advocacy group and others that model themselves after it needed to change. And if you recognize you need to change, and if you can't figure out the answer, maybe be willing to move out of the way and let somebody else do it. Like a step up and step back is my favorite thing to do. So when you don't see Kamari, it's not because I've burned out and ran away. It's just because I'm trying to create more space for other people. I don't have to agree with your idea. I don't have to think it's the best idea in the world, but I want to give everybody a chance to try to do something better than what I've planted seeds for, or the people before me planted seeds for. So I think I'm saying two things. It's like, stop being complacent. If you're identifying the complacency, be willing to move out the way and let somebody else try to come up with some innovation and some fresh ideas. I think that's been mentioned in the chat a few times. And trust people to mess up a little bit. Like, trust people to drop the ball. You can't hold everything.
Mm-hmm.
It's not healthy and it's not sustainable. So that's what I'll kick off with, of lessons learned.
I want to add to what Kamari just said, and also we did the same thing with the Voting Rights Act. With folks getting too complacent around how in which things have been done or continued to see. And we have to understand, for whatever act that we do get passed, whatever policy gets passed, or even cultural changes, there is a counterpunch or a counter to that change. And sometimes, like, when it was actually in the Florida one where we found out that many of the policies that have been put in place before, even when we talk about Project 2025, you got to go back to the 70s, late 60s, of right after they passed the Civil Rights Act. Is that there was a Supreme Court justice who served at the same time as Thurgood Marshall, who we all know who Thurgood is, but we actually don't know the corporate leaning conservative judge who also was helping put conservative passage to be able to get to where we are currently within the current administration, that is able to pack a court, that is able to dissolve many of those acts that have been put in place over the last 50 years. And as they continue to potentially do attacks on marriage equality, as they continue to do attacks on our ability to have education and even talk about the real history of Black people in this country, they will continue to make that even harder to push for a racial capitalistic society that they would actually like to see. And since we do know that, we also know that we have to go deeper into the organizing practices that we're doing, and we have to do it more on a local level. I'm also going to push back against one of the comments. There was a lot of great comments in the chat. I ain't taking none away. But it was also this piece around angelic. We need more angelic troublemakers. And I do believe we need a bunch of good troublemakers. I love John Lewis. But also, we got to go over some of those not good troublemakers. I'm not going to use some of the other words I'll use, but also YNs. We got to talk to them. We got to actually engage them. And if you think them Black people ain't your Black people, then you are missing the mark on actually what we're trying to do. There's not enough of us. There's not, like, we need all of them also on our side. And one thing that I actually take from what I've seen the organizing on the right do was they took those folks that nobody wanted to touch, and they brought them in, and they trained them and used them in different ways to be able to do different actions that they've done across this country, and actually the world, if you especially look at Eastern Europe. And so we have to actually take a play. I'm not, I don't want to take all the master's tools and use them to destroy the master's house. That's not going to work. But I do believe we got to take some of and use some of those tools as we also think about how we are building up our systems. So I think that's also another piece that we got to, take a little bit of also what they do and take in also some of those not good troublemakers and actually use their talents, because I believe everyone's got different talents to bring to the table. We got to use those talents and actually use them to continue to do it, but also teaching them the history that for most of them, they were never taught.
Yes. So there are some interesting comments in the chat. One, you all picked up on a couple around Black leadership and Black-led organizations. One comment, I'm just going to run through them and y'all can decide what y'all want to respond to. One question, can someone identify and track a prominent Black leader and organization in each state who has been successful that we can collect and bring together to start an effective coalition? Another comment is around USCHA. I know Leisha's in the room, so she probably has I know she has a response to this one. My question is, what about hosting a Black affinity gathering at USCHA and expanding this conversation? And then Juan asks, how do we address our drive over Black folks who are actively tearing other Black folks down for whatever reason? So that's what's floating in the chat. You all jump on whichever one you want to respond to.
So I will comment, I guess, to Juan Michael's thing. I don't tear down other Blacks, even when I don't disagree with them. I do drive around them. I don't, just like, Black folks have the right to be wrong, is the way I see it. And I do not spend energy um, tearing down other folks. I just focus on my message and the people want to hear it. Because of that, maybe I have actually changed some people's impression because I don't knock them from where they're at. And if I'm with somebody or I was registering to vote and people would come to me sometimes, or we ain't no reason to vote this and that, and be, I might say a couple things, but if they're really insistent, I don't go into we died for this. I say, okay, if you don't want to vote now, what's important to you? And then I might find, well, then what are you willing to do? Maybe they'll help volunteer at the table, even though they don't want to vote, because as long as I can stay engaged, if it's not, hostile, then we can change some minds. But I don't spend any amount of time other than making sure I have my counter arguments to what's, being prepared with both sides of the argument. I just don't spend energy on other people who are talking a negative or in a different way. I give them the right to be wrong. And just like I think we live in the matrix, all of us ain't unplugged, right? And I see them as not unplugged. And if we keep working for liberation, we can possibly unplug them one day. So I don't talk about that at all. I tend to focus on what we need to do and who wants to do it. And if you're going to come to me bitching about what they need to do, first I'm going to ask you who's the they, and I'm going to ask you, we'll follow you. What's your idea? Because it ain't, we can all do something. And so I'll stop there. But I love what someone is in there talking about. Um, Coalition. I can name someone in every state who has a leader doing something. All of them don't have the same idea about working with new people, like for instance I do, but there are a lot who do. So don't think there is none of us, because there, Alicia McKinley is on here. I know Marsha Martin is on here. I know a bunch of folks. I do this all the time. So stop focusing on the ones who won't build you and find the ones who will. And I guarantee you they're there. You saw me and Max's email in the PowerPoint that will be emailed out. Email one of us. Don't you're wasting energy focusing on what people aren't doing. There is gatekeeping going on. But remember this, people are fighting for resources. They're fighting for survival in their lives. So they don't see the need to work together the way we need to do. And you can be that role model that shows that, but not by talking against it, just by doing what you do. So that would be my comment.
I wanted to thank you for that, Vanita. And I wanted to quickly take on the USCHA comment. I think affinity sessions are amazing, but I also think whoever the audience is that's going to be at USCHA, that'll be potentially outreach to attend that affinity session, that information should be captured well before we get there, as well as the people who won't be at USCHA that will be missing out on that conversation. I find sometimes we have affinity sessions at conferences and they don't live beyond the conference, which gets very, very as somebody who attends a lot of conferences, it gets really frustrating to like keep track of all the conversations and like, what is the strategy? Like, who is the person that's going to hold the theme? I don't want to meet just to meet, but I'm happy to facilitate conversations and ideas that we can take into spaces that already exist. And the second part I want to add to that is something I think more than an affinity session, and I think there's been some conversations with Harold, I don't know, about having some sort of like a drop-in activist space where people can make phone calls, ask questions, to the point in the chat around how governments work and understand budgets and understand all the jargon that comes out around appropriations. I don't know if that's going to exist at USCHA, and I don't think it should only live at USCHA. HIV is Not a Crime Training Academy launched something similar to that. We called it the ACT UP Room last summer. And we're more than definitely going to unfortunately need it next summer to activate folks as well. So I think if you're having a convening where you're going to have more than 100 folks in a space, you should have intentional agenda time to say, this is where we're going to stop for 30 minutes and either answer questions, call legislators, write letters, whatever that thing is. Build it into the space that already exists for you. And I think that can happen at USCHA as well. I want us to also think beyond those spaces, because at USCHA is a very specific audience, and then some of those individuals go back to their organizations that don't necessarily have, I don't know, policies in place for them to be able to activate the way they want to, where they might risk losing their job. So I would love to hear more about this and maybe be more intentional about how we build that out over the next couple of years. Yeah.
Man, I just want to give a shout out to Kamaria. What she's actually talking about and like building past it in the affinity session is what Bully was. What both Vanita and Kamaria have talked about, right? Which is the Black United Leadership Initiative, which came out of white people being racist at a conference years ago, and folks trying to build that out. And I would also, Vanita's kind of like alluded to it, is white people being racist is also how Black South Rising came together. Because we are tired of white folks in the South representing the people that are actually the most impacted in the South. And it's important for us to have those spaces. Another piece just around, like I had answered Juan Michael's piece. I think that was an excellent question, but what I also, there's a couple of different ways that we can organize. Vanita's a more healed individual than I am, so is a little bit nicer maybe in not calling folks out by name. But I think there's also a time and space to call folks out by name in spaces where definitely harm has been done, and to be able to try to heal from that space. And also, I'm taking this from some stuff I heard from Adrian Brown and Yolo a couple months ago, is that healing don't happen in these big rooms, right? And sometimes, especially when it's black and black, I was like, it's important to have that conversation to the side, talk to, actually had a conversation. And that's not always the easiest thing to do, right? But it is important to actually have those spaces and make sure that we can break bread and talk about how we move forward together. So then when we're in mixed company, we're able to move in a more I don't think all Black people got to align, but we understand where each other is before we even go into the room and understand how we can continue to move forward. I've done that with some of the folks who's been on these calls that I don't always philosophically agree with. And I've seen us be able to use that in a way, but also seen folks be able to take that away from us, or try to, water down that space, or bring in, one of them Black faces that ain't really with us, and make it harder for us to then be able to continue that movement. And we got to be able to, see what that is, call it out, and then, organize in one of those three different ways to think about how we move forward.
That's one of my favorite conversations is the Black solidarity. I decided a long time ago I'm focused on Black solidarity. I can't be focused on what the white folks doing. I think that's a whole nother couch conversation we need to have, but it's critically important to this power building that you all are very clear about that we need to be doing. So we have like 2 more minutes, right? And so I want to invite you all to think about one thing that people need to do, that people can do after this couch conversation to build power within their local environment, or at the state level, or or some of these federal ways at the federal level, or one thing so that people have something practical to walk away with, right? We've talked a lot about a lot of things. We have a framework that people can start chewing on and building resources around. But I'm all about what can people do in this moment right now that's practical to them. So one thing, I know y'all got like a list of things, so that's why I'm giving y'all some time to think about that one thing that's on that list of 20, 25 things. So as we close, if you all share one practical action that people can take as a way to start building or continue building power at the local, state, or federal level as it relates to Black folks and HIV. Anybody can start.
So I'll say this, and I know that everyone here may not have a Black-led or a group that they can go back to, because my first thing is start where you're at, is whether it's with family, friends, or in a current group that you're in, and take these slides in this chat and go back and have that conversation, and how and make a very local target of something you may want to do. How can you might be already engaged in an activity. How can we rethink what we're doing using this framework? So start where you're at, who you're working with, and think, now that we've learned this, how can we shift it, or do we need to shift it, or is it the shifting in our thinking, the way of doing this in a way that we're not just providing a service, we're also building power too. So I would start there and begin to just have that conversation locally, because it's not just the federal. We need to think, our city government's getting less money now. Who's asking them what they're going to do? The counties are getting less. They're going to get the states. You don't have to all think federal. It could be your PTA. I don't care. Take this back and talk to folks about how we can shift the way we do what we do to where it can be power building. So I say start where you're at. And then once you do, if you need help, reach out. Ask for help. Don't stop. It could be UWR, it could be Max or I, but don't stop. Start where you're at and ask the questions and have the conversation.
I'm so glad
Max, one thing as we close.
I'm so glad that she went first, because I could not think of one thing. And you said one of the things I was thinking of. The other one is I'm reading the book. I'm reading Political Determinants of Health. And I would love if folks want to have like a virtual like chat about the book, because it's a little, it's wordy, but it's a good one. So highlighting questions I have, taking them back to Miss Vanita. But I think that's one of my commitments. That's where I'm starting. You can be a great leader and still be open to learning. And I've been listening to my team this for a while. So I think, again, back to Vanita, starting where you're at.
Thank you. Max, close us out.
In addition to reading and getting into the books, really like understanding what's going on, is I encourage everyone to join a base building organization in your local community. Whatever that is focused on, it doesn't have to be focused on health. It could be focused on a number of different issues that are also impacting with folks, and to actually do the political education with them, with the folks that you are building with. That is important for building long-term political solidarity and being able to build political power, not just in your local community, but also as we are also global advocates and advocates wherever we are. It's important to have that connection, not just in our local community, but also abroad.
Great. Thank you very much, everybody. I am moved and encouraged by this conversation, as always, even just being in space with all three of you all. United We Rise will be back with our couch conversation, not next month, but in August. Some of you all probably got the message that we have changed our time to come together. We'll be doing couch conversations every other month instead of monthly. So join us in August for our next couch conversation. It's going to be just as dope. And we're going to have just as an engaging and exciting conversation. So thank you, everybody, for joining us, and we will see you all next time. Thank you, guys.
Thank you, everyone.
Thank you so very much, and thank y'all for putting this together.